You're listening to The Pulse on AMI Audio. I'm Grant Hardy. May is Vision Health Month. It's that time of the year to remind you about the importance of booking an appointment with your optometrist. The Canadian Association of Optometrists has launched a new digital campaign to raise public awareness about eye health and vision care. And here to tell us more is optometrist Dr. Martin Spiro. Dr. Spiro is the president of the Canadian Association of Optometrists. And Dr. Spiro, welcome to The Pulse.
Thank you. Thank you so much for having me. Appreciate it.
If you don't mind telling me just a little bit about your role, what you do, and why you're passionate about this kind of work.
Yeah, thanks for the question. I am Martin Spiro. I'm an optometrist practicing out of Montreal, Quebec. I work in a group practice with another 9 optometrists in the West Island. And I also work 1 day a week at the MAB Mackay Low Vision Rehabilitation Center, where I work as part of an interdisciplinary team seeing patients affected by visual impairment. And I am the current president of the Canadian Association of Optometrists, so advocating for eye care, optometry, the importance of primary eye care, preventative eye care, which falls in line with public awareness, and why we are passionate about bringing that to light for many people through our public awareness campaign, which encourages people not to wait and to go see an optometrist on the regular.
What exactly is Vision Health Month?
Yeah, Vision Health Month is a month that's recognized by the federal government and really there to raise awareness on the importance of vision health. I think we know that many people take vision and eyesight for granted. And we also know that many types of vision loss are irreversible, but preventable through early detection. And so the importance of making people aware that eye health and vision care is something that they should regularly incorporate into their healthcare routine with frequent visits to the optometrist.
I actually find it I've always found it fascinating, to be honest, and reading your press release gave some interesting data. Just about everybody will have some sort of vision related change or eye health related concern at some point in their lives. It's so interesting, and we don't actually hear more about this just through historical literature and stuff like that, but it's just how prevalent the issue is interesting. And yet only actually up to 45% of Canadians say they don't really know enough about looking after their vision. And this is definitely not something that is talked about enough. Do you have any thoughts on why that might be, that the awareness of these issues is just so low?
Yeah, I think it's because, we tend to only address something when we feel it's wrong, right? So, for somebody who feels that they see okay, their eyes are relatively comfortable, they may think that they may not need to go visit the eye doctor, get an eye exam, see their optometrist. What we're trying to say is that, well, many of these conditions start off without any symptoms, but they do have signs, and those signs can be detected during a regular eye examination by an optometrist. For instance, if we look at glaucoma, which is one of the leading causes of visual impairment in Canada, well, a patient could have high pressure in their eyes without feeling it. The pressure in the eye, there's no sensation that we could feel pressure in the eyes for other reasons, but actually having a high pressure in the eye is usually asymptomatic. And what that could do is start damaging the optic nerve. Well, if we're able to address that condition early and treat the pressure before it damages the optic nerve, then we save sight. But if that's too late and that pressure has already damaged the optic nerve, it's irreversible. So a lot of these things, even if we're talking about dry eye, something that many, many people encounter, optometrists are able to detect by looking at the surface of the eye, the glands around the eyelid, whether that patient is at risk of dry eye, even if they're only having, maybe an occasional feeling of dryness, maybe once a week or something like that after a long time on a screen. But the optometrist is able to assess the risk of, okay, are you going to, should you incorporate something in your routine to prevent more severe dry eye down the line. So there's many conditions, as you alluded to, that many Canadians will face over their lifespan, which will affect their vision and their eyes. Many of them start off asymptomatically, but can be detected. So that's really the message that we're trying to share.
Is dry eye also something that could be either irreversible or more problematic if you let it go? It's not just something that you can sort of lubricate your eye if it comes up, but it
Yeah.
might actually lead to further problems.
Absolutely. So there's stages of everything, right? So
Yeah.
at a mild stage, dry eye is something that we could address with lubrication through artificial tears and a hot compress. For some people, though, they may be on certain medications or may have certain systemic conditions that compound that. And what we can see is in those severe cases of dryness that it does actually cause visual impairment by creating a lot of inflammation on the cornea and actually causing some damage to that. So those are, the more extreme cases that would either require intervention or medicated eye drops that we do see. So there are cases of that. The vast majority can be, like as you mentioned, treated with lubrication, and even many will not progress to those more severe stages.
Mhm.
But there are instances where we do see devastating effects from the ocular surface being dry and inflamed for too long.
So the eyes are perhaps one of those organs that sort of lure you into a false sense of security by appearing to be stable, whereas in reality, it's a little more like blood work or those other tests where you just don't know that something could be wrong unless you get it professionally checked out.
Yeah, and that's a great point, and it's a great segue into the things that can be detected in an eye exam that may not even be related to the eye. The eye, we have that saying, "The eye is the window to the soul," but it's also the window to systemic health. Optometrists, when they look in the back of the eye, these are the only blood vessels that are really optically visible through looking in the back of the eye at the microscope or through retinal imaging. And by looking there, optometrists can detect early signs of diabetes, high blood pressure, cholesterol. So, not only eye conditions, but also systemic conditions, which can have their first signs in the vasculature at the back of the eye.
Yeah, I think there may be a bit of it may not be such a misconception necessarily, just as an easy thing to forget that if you are born without vision and you have a stable condition, it's not cancer or anything like that, your eyes just don't provide visual feedback, that it may not be a part of the body that you really think or remember about. What would you say to someone who maybe doesn't use their eyes at all, so it doesn't feel like it's an important thing to get checked out?
Yeah, I would say that there's many structures in the eyes that optometrists are looking at during a regular eye exam, and vision is obviously part of an eye exam for most of the population. But for people who are light perception or no light
Mhm.
perception patients, other structures are being looked at in the eye, the eyelids, their health. We know that many types of skin cancer, a disproportionately high amount of skin cancer, are on the eyelids. We're also looking at the back of the eye. We know that things like tiny birthmarks that are called navises, which could
Mhm.
appear in the back of the eye, do have a chance to become choroidal melanomas. Now, the chance is low, but it is something that is sometimes picked up on eye exam. There's also inflammation, like we talked about. Even for
Yeah.
people who have no vision, it's important to make sure that their eyes feel comfortable over their lifespan as well. And optometrists play an important role in that as well. So there's many different aspects. And then we just talked about all those systemic things that could be detected through an eye exam as well. So there's many different aspects of a routine eye exam, both for the sighted and visually impaired or non-sighted community as well.
Absolutely. Yes. And you certainly had talked about a lot of very critical health complications. I just thought we'd kind of sum that up because it's definitely something I have to remember about myself that it's still
Great question. Yeah.
unfortunately
So,
get that done.
even us,
Um,
we we need to get it checked out. As an optometrist as well, I'm probably due for my next eye exam. So, yeah.
how often should people be going, and what should people expect at their eye exam?
Yeah, great question. So the CAO does have frequency guidelines that are available. How often, changes slightly depending on the time of our life that we're in. So, as children, we recommend, a first eye exam at 6 months to make sure that there's no severe conditions that, optometrists can detect. An eye that's turned, what we call strabismus, a very, very high refractive error, other conditions in the eye that could be detected, like retinoblastoma and other types of affectations which can affect infants. And then an exam, at age 3, 3.5, and then at the school age, one exam every year. So for kids, if everything's going well, okay, and there's no eye issues, then
Mhm.
they should be having eye exams once a year up until age 18. As healthy adults with no eye conditions or other systemic conditions or taking any medications which may need more frequent eye exams, adults with healthy eyes recommended once every 2 years. And as we know, as we age, the incidence of eye conditions, eye disease, glaucoma, cataracts, macular degeneration, as well as the systemic diseases that we detect in the eyes, diabetes, high blood pressure, become more prevalent. So, as seniors, it returns again to once a year for people with no other known conditions in their eyes as well. So, it goes from once a year to once every 2 years and then back to once a year as well.
Sure, that makes sense. And especially for people who maybe are either intimidated, or also people who are curious about how it would work with their individual level of vision or eye condition, what do you expect when you show up at the eye doctor?
Yeah, great question. So, it's first of all, I think it's I like it. I do it every day, all day. So I think it's usually a positive experience because we're really looking to help people, maximize their eyesight and maximize the health of their eyes during every visit. So we'll usually start off with an intake questionnaire, get to know our patients. Both in terms of their eyes, but also their lifestyle and how they use their eyes in the day to day. Are they someone who drives a lot? Are they someone who drives a lot at night?
Mhm.
Are they someone who working a lot on a computer or on their phones? What kind of hobbies do they have, and how are they using their eyes in those hobbies as well? And then we'll usually look at what they're using currently. Are they using glasses? Are they also using contacts as well?
Mhm.
What type of contacts? So, what types of are they? If they're visually impaired, what types of aids are they using for that as well? So, we're looking at kind of what they're already using and what they have, and then we'll do generally a check of the vision as well. So, and in that, sorry to go back, but during that intake, we'll also ask questions about general health, previous eye surgeries or conditions, and family history as well. So there's a big case history that goes beyond the eye to lifestyle and also general health. And then, like I
Mhm.
mentioned, we'll check vision, both the distance and near vision, and any other vision that the patient reports that they're using as well. And generally, also to look for how the muscles of the eyes are working, the ocular alignment of those eyes to make sure that the eyes generally work together. And we'll also look at color vision, 3D vision, the pupils, which tells us a lot of how the optic nerves are working and the connection between the eye and the brain. Are the pupils reacting to light? Then we'll check what we call the refraction, which is basically looking at the prescription and the visual field, which detects the peripheral vision and how well we're seeing there. The eye pressure, which we need a certain amount of pressure in the eye to keep it
Mhm.
round, but too much pressure puts strain on the optic nerve and could lead to conditions such as glaucoma. Generally retinal, and then we'll check other aspects of the eye health. So, like we talked about, the eyelids, the different structures of the eye, generally that's looked at under a microscope. And we'll also usually now incorporate retinal imaging into, so we always looked at the retina during an eye exam, but right now with advanced imaging, we could really look at parts of the eye that weren't necessarily visible previously, like different layers of the retina through OCT imaging. And now we also have wide field imaging that allow us to get views and capture images of really a wide field of the back of the eye as well. So I probably, skipped over a few things, but it's usually a thorough exam. There's also, if we do see other things, we may want to do additional testing, like a dilated eye exam, where there'll be drops put in your eyes to get
Mhm.
better views in different areas, as well as other types of testing as well, if there's anything else that is uncovered. So we really have a whole host of tools and things. But like I mentioned, the main goal is to ensure that our patients are maximizing their vision, getting the best out of it, and also maintaining healthy eyes through their lifespan.
Certainly, as an adult, your any that type of eye exam is not painful or anything like that. It's more just interesting. Would you say it? It shouldn't be an overly stressful experience. Really, it's sort of an in and out
Yeah, it generally
set of
takes
tests.
maybe about 30 minutes. And yeah, there's generally, sometimes people, are maybe a little afraid of the air puff that detects the eye pressure, but it's not painful. Sometimes when we're dilated, we can have a little bit of blurry vision after, and some of the drops that are instilled could tingle. But generally, yes, there's no, pain involved. We're not extracting anything like a dentist that could have something like that. Generally, it's a non-painful experience, that when you visit the eye doctor. And I think many people, like it because there's, many people come in maybe with an issue that they want to, and
Yeah.
optometrists are generally able to provide a solution for that as well.
So definitely important to get that done. Talking about the educational aspect, first of all, can you elaborate? Tell me a bit about the hashtag Get Eye Wise, I believe it is, the campaign for a Vision Health Month here that you've created for some public education.
Yeah, so Get Eyewise is generally the campaign that we use for, like, the overarching campaign that we use for all our, social media digital campaigns. So that runs year round. And that's, led by the Canadian Association of Optometrists, but supported by many of our member provinces, as well as some industry partners as well, that collaborate together to create awareness about the importance of eye exams. And then twice a year, we have a larger digital campaign. So in May for Vision Health Month, and also in October for Children's Vision Month as well, a little bit more concentrating on children's vision. So generally, our May campaign stresses the importance of early detection and regular visits for an eye exam. And this campaign kind of focuses on not waiting until
Mhm.
you're detecting too many signs of needing an eye exam, and that if you're really seeing those signs, it's already a red flag and too late. So it's a green flag to go and get regularly checked and get in early before we start having those issues.
The Canadian Association of Optometrists maintains a comprehensive health library as well that people can actually check out just by visiting your website. Can you tell me a little bit more about the kinds of information that people can glean from that health library?
Absolutely, yeah. So the Canadian Association is there to be a trusted resource for the public. A resource for our members as optometrists, definitely. But we also take pride in being a trusted resource for our patients and the public at large. So what you will find on that eye health library is basically, if you have any questions that are eye related, you'll find resources there, from anything from floaters to UV protection to even, an eyelid twitch. Any type of kind of eye related issue, you could check there. The language is made to be understood by the population at large. It's not super, scientific that you would need, you know bachelor's degree in science to understand the terminology there. So it's really there to be, a trusted resource for the public on eye and vision related issues. And I encourage you and your listeners to visit it. There's a lot of interesting information there if you're curious about kind of any aspects that involve eyes.
What were your goals in establishing this resource and making it open to the public?
Yeah, I think that's it. Our mission is clear vision and healthy eyes for all Canadians for life. That's our vision and what we strive to do. And part of that is making that resource accessible for the public. There's a lot of information that we could find out there. Some of it is not evidence based, and I just want to give a shout out to the amazing
Mhm.
team at the Canadian Association of Optometrists who really do great work in making sure that everything in the eye health library is evidence based. So, when people are looking at, getting information about certain things, there's a lot of information out there, and some of it, can be trusted more than others. So, having that Canadian Association of Optometrists representing a trusted professional that provides evidence based information for the public at large really complements our mission and what we're trying to do as the Canadian Association of Optometrists.
And before we talk about kind of the future of optometry and eye care, can you maybe just share a couple of tips for looking after your eye care, your eye health at home?
Yeah, so I mean, how much time do we got here? But yeah, so it's that's a great question, and I would say I've already hammered it home. So I would say the most important thing is that routine
Get
and
checked
regular
out.
visit to that eye doctor, because even if we think we're doing everything right at home, there could be underlying things that we may not detect.
Yeah,
But
that's totally
otherwise, I would say you know, first and foremost is UV protection. We want to make sure our eyes are protected when we're outside. And, a lot of damage, whether it be some of the stuff we mentioned, cataracts, cancers on the eyes or on the eyelids, other damages that could happen to the cornea, could all, even macular degeneration, all these things, UV plays an important role, and UV prevention plays a more important role in preventing that. So I would strongly recommend that. The other thing is making sure that our eyes are working properly. We spoke about dry eye, making sure that they're lubricated if you have anything like that. And then generally also making sure that your eyes are used optimally. It's very straining when we don't when sometimes we may think that something's off. Well, maybe it's the fact that you do have an underlying condition in the eye that's not addressed. Maybe it's the fact that your prescription is not in line with the exact activity that you're doing as well. So making sure that you have the products available for you that really suit your needs is important. I know a lot of people say say that they have issues looking a long time on a screen, eye fatigue,
Mhm.
eye strain. So also important to take breaks when we're using digital devices. And the other thing at home is, I keep hammering on the same point, is that if you are noticing something
Yeah,
that's new, a change in your vision, new floaters, some flashes, some visual sensations that were in there, you're feeling something that feels a little off, don't wait.
don't let it slide.
Book,
Yeah, that's
book an appointment with an optometrist, and they'll get to the underlying issue that you're having. And sometimes it's something that's easily fixable, like we said. Maybe the prescription needs to be updated. Maybe you need lubrication, but sometimes it could be the signs of maybe something that's an early disease or something like that, which if caught early could be sight saving.
we are almost out of time here. So I'm just curious about talking about your strategic plan. There are many pillars that you're covering here. One of them is technological change in optometry for the future. Can you talk a little bit about technology and how it's going to change the landscape?
Yeah, I think that it's a great question, and we're already seeing that changes happening. The whether that be through artificial intelligence, and we are seeing that in the diagnosis aspect, but also the physician assistant aspect. So both in terms of detecting certain conditions in the eye that AI can help a clinician detect, but also what we see with talking to a patient, that AI could be an assistive tool, whether it be through note taking or that allow the physician a little bit more time to spend face to face with a patient and not necessarily note taking. So there's many different aspects that technology is bringing to optometry, and we're seeing that as a tool that we could use to enable best patient care. And there's also technology now being used to deliver remote care. So we're seeing optometry being used in some cases for teleoptometry and being able to give certain consults, especially if we're looking at people in rural or remote locations that may need a follow up with their eye doctor. That some teleoptometry where a assistant can operate the machines there, and the optometrist would be live on a video, much like us right now, looking at the data coming in and consulting and advising the assistant and consulting the patient in real time as well. So there's a lot of new technology that we've seen in the last 5-10 years that is being used as tools, which optometrists are employing to be able to either see more patients or being used clinically in terms of diagnostics and physician help that we've been incorporating as a profession. And as the Canadian Association of Optometrists, we want to make sure that we're leading the charge, that these technologies are being used to benefit both optometrists and their patients as well, and that they're safe. That the data behind them is robust, it's evidence based, that it's secure as well. So we want to make sure that these technologies are indeed in everyone's best interests.
It seems like the pace of technology has the promise of changing things very quickly. So hopefully within the next few years, we'll really see some greater accessibility for care, especially in some more remote areas. I really appreciate your time here, Dr. Spiro. Hopefully, we can do a part two at some point. Thank you so much for coming on the Pulse today.
Thank you so much for having me. Really appreciate the opportunity and really appreciate everything you're doing in terms of raising awareness on the importance of eye health and vision care. So appreciate all the work you're doing as well.
Awesome. You as well. Thank you. That was optometrist Dr. Martin Spiro, president of the Canadian Association of Optometrists. Their website is opto.ca. The Pulse airs on Tuesdays and Thursdays at 1 p.m. Eastern on AMI Audio, repeating every 6 hours. You can also watch the show on YouTube or catch The Pulse wherever you get your podcasts. I'm your host, Grant Hardy. Thanks so much for listening.